I'm Joe Graydon.
And I'm Terry Graydon. Welcome to this podcast of the People's Pharmacy.
You can find previous podcasts and more information on a range of health topics at peoplespharmacy.com.
Have you ever had a creepy, crawly feeling in your legs? Restless leg syndrome affects at least 1 in 10 Americans. This is the People's Pharmacy with Terry and Joe Graydon.
Restless leg syndrome, or RLS, is an unpleasant feeling that's only relieved by moving. It makes traveling challenging and often interferes with sleep.
Is there anything people can do to ease this uncomfortable feeling?
Our lines are open for your calls and questions. We'll also be talking about leg cramps, muscle jerks, and neuropathy with Dr. Andrew Spector. The number 888-472-3366.
Coming up on the People's Pharmacy, restless legs, muscle cramps, and sleepless nights.
In the People's Pharmacy Health Headlines, for the first time since the pandemic started, influenza killed more people last week than COVID-19. The CDC is now classifying this year's flu season as high severity. That hasn't happened since 2017. The CDC says that somewhere between 30 million and 50 million people have caught the flu, and as many as 800,000 have been hospitalized. Experts wonder how effective the vaccine is for this year. We won't have an answer to that question for months. But in South America, where the flu season is pretty much over, the shot was about 35% effective. While public health experts are still encouraging people to get vaccinated if they aren't already, vaccination rates this year are lower than last year. It seems the flu virus might have benefited from vaccine hesitancy.
A measles outbreak in Texas and New Mexico has public health officials worried. That's because this viral infection is highly contagious and can have serious outcomes, especially for young children. Texas officials report that this outbreak is the largest they've seen in about 30 years. Most of these children have not been vaccinated. In addition to the outbreak in Texas and New Mexico, the CDC reports that 5 other states have also reported measles cases so far this year. Pediatricians fear that many more people have already contracted measles, but have not been tested. One person with measles can easily spread the virus to 9 out of 10 other unvaccinated people.
To add to the worries about infectious disease, a Wyoming woman has been hospitalized with bird flu. She apparently contracted the H5N1 avian influenza virus from her backyard chicken flock. One person in Louisiana has died from this infection. At least 70 people have contracted bird flu. No one knows yet if the virus that causes bird flu will cause a public health emergency. Scientists studying avian influenza in 6 laboratories of the USDA National Animal Health Laboratory Network have been fired. This is part of the administration's efforts to downsize the federal workforce. These labs were already short-staffed, even though they act as the front line of surveillance for this worrisome outbreak.
Epidemiologists consider the chlorination of water to be one of the greatest public health advances of all time. That's because chlorine kills many of the microbes that cause waterborne diseases. But a new Swedish study suggests that there may be downsides. Chlorine interacts with naturally found decaying plant material in reservoirs to form compounds called trihalomethanes, or THMs. These are thought to be capable of causing cancer. In their comprehensive systematic analysis, the researchers found that exposure to THMs were associated with 14 different cancers. In particular, people with the highest exposure were 33% more likely to develop bladder cancer and 15% more likely to receive a diagnosis of colorectal cancer. Not surprisingly, the authors call for more research to establish the risk of disinfection byproducts. Until such studies are completed, people may wish to consider home water filters using granulated activated charcoal to remove THMs from their drinking water.
Have you been urged to eat your vegetables or follow a plant-rich diet? Scientists now have data linking flavonoid-rich dietary choices with healthier aging outcomes. Flavonoids are compounds in plants that give them color and flavor. They're more abundant in minimally processed foods. The Nurses' Health Study and the Health Professionals Follow-Up Study are long-running cohort studies that have collected detailed health and dietary information from thousands of participants for decades. This analysis incorporated data on more than 62,000 females and 23,000 males over 60. Those who consumed diets rich in flavonoids were 15% less likely to become frail, 12% less likely to have poor physical function, and 12% less likely to have poor mental health. Specific foods contributing were tea, apples, red wine, blueberries, and oranges. And that's the health news from the People's Pharmacy this week. Welcome to the People's Pharmacy. I'm Terry Graydon. I'm a medical anthropologist.
And I'm Joe Graydon. I'm a pharmacologist. Today, we'll be discussing a bunch of uncomfortable conditions that affect our legs. Restless leg syndrome, or RLS, leg cramps, muscle jerks, neuropathy, and something really scary, akathisia.
Well, more to the point of affecting our legs, they affect our sleep. And we invite you to join the conversation at 888-472-3366. Give us a call, or you can email us your questions. It's radio@peoplespharmacy.com.
Have you ever experienced restless leg syndrome? We'd love to hear your story. What's it like? Give us a call. That number again, 888-472-3366.
Today, we welcome Dr. Andrew Spector to answer your questions about restless leg syndrome. He is an associate professor in the Department of Neurology at the Duke University School of Medicine. Along with his clinical practice in sleep medicine, he serves as the program director of the Sleep Medicine Fellowship, the Duke Athletics Sleep Optimization Consultant, and the vice chair for professionalism, inclusion, diversity, and empowerment. Dr. Spector is the author of Navigating Life with Restless Legs Syndrome. Welcome, Dr. Spector.
Good morning. Thank you for having me.
Thank you so much for joining us today, and we welcome your calls. Again, that number, if you've ever experienced RLS, is 888-472-3366. Let's start with the basics, Dr. Spector. What is RLS?
RLS, restless leg syndrome. It is a condition, very unpleasant sensations, usually in the legs, that make people want to get up and move. It's an urge to move. It doesn't have to be in the legs, but it usually is. And it occurs primarily later in the day. So symptoms develop usually in the evening or on your way to bed or when you get into bed. And it's better when you get up and move. So this is a problem that you could solve if you could be moving all the time.
But this is a real problem if you're on an airplane, if you're in a car, if you're on a bus. What do people do in those circumstances?
Yes, it can be very scary if you're trapped in a place like an airplane because you can't get up and move at will. So there are a variety of techniques people have adopted and medications to treat it. We also try to prevent it.
Well, speaking of prevention, we do have an email. This email is from Parrish in Culver City, California, who writes, I began having RLS episodes when I was in college, so I have more than 60 years of experience. About a year ago, to get some exercise, I began dancing to oldies rock for 15 minutes each night right before bed. My episodes of RLS are twice a month now instead of 3 or 4 nights a week. Another benefit of this is that I dare not skip my exercise. And goes on to say, another way to relieve RLS is to swing each leg vigorously from the hip, about 20 arcs. I hold on to the door frame when I do this. So What do you think of Parrish's preventive approach?
I think that's great. There's a good deal of evidence that moderate intensity exercise of the legs over the long term will help improve restless legs. What can make it worse is a change. So if you suddenly stop exercising or start exercising too intensely, you can actually make it worse. But it sounds like you,
Parrish has
Parrish has
found
found the happy medium there, and that's great.
Now tell us, Dr. Spector, what causes RLS?
So the prevailing theory right now is that it's a state of low iron in the brain. And that gets tricky because when we measure iron levels, we're measuring iron levels in the blood. So it's hard to determine exactly how much iron is in the brain. But when they do research doing spinal fluid tests, they can see that the levels of iron in the brains of patients with restless leg syndrome are markedly below those without restless leg syndrome. And when we treat with iron, we can make people a lot better.
how much iron are we talking about? And is there any way to determine how much iron somebody might need since you can't actually measure the iron in the brain?
We don't practically do it. It can be done, but it requires spinal tap, so we
Yeah,
choose
no,
not to.
that's
Right.
that's
We're not going to
definitely
actually do it a lot. So we do have blood values that we use, but they're not the normal values you might get from the lab. So the lab might say a lab called a ferritin. Ferritin is how much iron is stored in your body, and they'll say anything from 11 up could be normal. But in the restless legs community, we're going to want that at least 100, markedly higher than what the lab is going to say is normal. And there are other measures called a transferrin saturation. We want that above 20%, and the lab might say normal is above 15%. So we use just a higher standard to ensure that there's enough iron available to get into the brain.
So iron deficiency is a potential cause. Anything else?
So there are theories about nerve damage in the legs causing it, and you'll see people who've never had restless legs who may get a knee replacement, for example, and all of a sudden they'll have restless legs on that side. So I think there are other causes, and I don't mean to say that iron deficiency in the brain is the one and only cause. It's just the best elucidated of them.
And how do you diagnose it? In other words, if somebody goes to their family practice physician, they may not even have a good name for what they're dealing with. How does that doctor either figure out what's going on or refer to who? A neurologist?
Well, there are several different kinds of doctors who practice sleep medicine. Neurology is one of them. Anyone trained in sleep medicine will have training in restless legs, and other neurologists will as well. But to diagnose it, you can certainly be diagnosed in the primary care setting. And it's a subjective diagnosis, meaning if you have the symptoms, you can make a diagnosis without any formal testing for restless legs.
We want to know what it's like to feel restless legs. So give us a call, 888-472-3366. If you've been experiencing restless legs recently or your whole life, let us know what it feels like. 888-472-3366.
Dr. Spector, there are some things that people who have not had restless legs might get confused with restless legs. So I'm going to go through a few. You talk about them in Navigating Life with Restless Leg Syndrome. Muscle cramps, or neuropathy, or sleep onset myoclonus, which sounds very technical, but I think a lot of people have experienced
Well, let's find
it.
out immediately. What is that?
Well, sleep onset myoclonus goes by another name. It's also hypnic jerks. And as you're dozing off, as you're about to fall asleep, your body will have a jump or a jerk. Maybe you'll feel like you're falling.
Yeah.
A lot of people have had this, right?
Yes.
That is a very normal phenomenon.
Well, I can tell you, I can tell when Terry's just about to fall asleep because her legs start moving.
Aha.
Not a lot, but enough that if I was asleep, it'll wake me up.
But they don't move all night long.
No, just for that minute or two.
And so there are conditions where it's just at the beginning before you fall asleep. There are conditions where your legs will jerk through the night. But in this case, the sleep onset myoclonus is really right at that moment of transition. And if it's really problematic, it can occur so much that a person won't be able to fall asleep. Every time they transition into sleep, they'll jerk themselves back awake. And that's really a problem.
It
But
is.
it's not quite the same as restless legs.
It is unpleasant to be awakened by your legs moving.
Hmm.
Let's go to the phones. Debbie in Spartanburg, South Carolina. Tell us about restless legs and your experience.
Yes. Hello.
Hi, Debbie.
So I do the river dance in my sleep, and I didn't realize it until I kicked my dog off the bed, and they're like, "Man, you're constantly moving," and so I feel like I don't get into a deep sleep. And sometimes I'll wake up and take some magnesium, and it does help relax my legs some. I don't know if there's anything else that I can take that would help it. And occasionally I'll just wake up with a super, super bad cramp in my leg that I can't even walk.
Ouch. I think a lot of us have experienced those leg cramps in the middle of the night when we're fast asleep. But let's start with the magnesium, Dr. Spector. Is that a reasonable approach for Debbie?
Magnesium, if it works, it works. Great. And there is not a lot of data, but I know a lot of people who swear by it, and I'm not going to tell you it's wrong, and I don't think it's going to hurt. So if that's an effective strategy for you, Debbie, then that sounds reasonable. But I do want to clarify the difference between restless legs and what you're experiencing. What you're describing sounds a lot like a condition we'd call periodic limb movements of sleep. And when periodic limb movements of sleep become so disruptive that you can't get a good night's sleep, now we call it periodic limb movement disorder, and it is treatable.
So, what do you do for periodic limb movements of sleep?
Well, I say it's not the same as restless legs, but it's actually treated very similarly to restless legs. And we would start with iron. We may even get a sleep study to quantify the degree of sleep disruption from the legs. And then if magnesium works, great, but there are other prescription therapies, and notably we would do iron therapy as well if needed.
Our lines are open for you to share your story or ask a question about restless leg syndrome or periodic limb movements during sleep. It's 888-472-3366, or you can email us radio@peoplespharmacy.com.
We're talking today with Dr. Andrew Spector, Associate Professor in the Department of Neurology at the Duke University School of Medicine. The book we're talking about is Navigating Life with Restless Leg Syndrome. We are going to take a short break, but we'll take more of your calls when we come back. Again, that number, Terry?
That number is 888-472-3366.
If our lines are full, you can send us email. It's radio@peoplespharmacy.com. And Terry, what's it like for you to have those little cramps just before you?
Oh,
not
they're
even a
not
cramp.
they're not cramps. They're different from cramps.
How would you describe them?
Well, I mean, they are hypnic jerks. Usually I am starting to dream something and I'm walking along and all of a sudden I miss a step and it wakes me up, which is annoying, but it doesn't happen every night.
All right. 888-472-3366.
You're listening to The People's Pharmacy with Joe and Terry Graydon.
This podcast is made possible in part by CocoVia, backed by 20 years of scientific research and the maker of the most proven and concentrated flavanol extract in the market today, Coco Pro Cocoa Extract. Cocoa flavanols are among the most studied plant-based bioactives today and are clinically proven to promote cardiovascular and brain health for the long term, supporting a strong heart and better memory.
Get 15% off your order of any CocoVia product by using the discount code PPOD15. Learn more at CocoVia, and remember that discount code is PPOD15.
These statements have not been evaluated by the Food and Drug Administration. This product is not intended to diagnose, treat, cure, or prevent any disease.
Welcome back to the People's Pharmacy. I'm Terry Graydon.
And I'm Joe Graydon. The People's Pharmacy is made possible in part by CocoVia dietary supplements. Cocoflavanol supplements that support cognitive and cardiovascular health, made with proven concentrated flavanol extract. More information at cocovia.com.
Today we're discussing RLS, Restless Leg Syndrome. Shortly we'll tackle leg cramps, neuropathy. We've just talked about muscle jerks. We may talk about it more. And something called akathisia.
Our lines are open for your questions and your stories. 888-472-3366. If our lines are full, which they are at the moment, you can email us radio@peoplespharmacy.com. Terry, do we have any way of getting to Kyle?
Yes, we do. But first, let me introduce our guest.
Yes!
Dr. Andrew Spector. He is an associate professor in the Department of Neurology at the Duke University School of Medicine. Along with his clinical practice in sleep medicine, he is the author of Navigating Life with Restless Leg Syndrome. And now, let us talk to Kyle in Claremont, Missouri. Welcome to the People's Pharmacy, Kyle.
Hi. Yes, I have restless leg syndrome, and I struggle with it probably 3 to 4 times a week. And I think it stems back, like the doctor was saying, from low iron. Back in 2004, I was diagnosed with UC, ulcerative colitis, and I battled that for about 6 years probably. And during that time, I had to take some iron infusions because my iron levels got so low.
Mm-hmm.
And so my wife had been doing some research about some different things, and she come across this vibration pad that you stand on, and I cannot remember the name of it. But anyway, you just stand on it, and a lot of people can exercise off of it. But you can just stand there, and for 5 to 10 minutes, whatever you choose, you just stand there, and the vibration has tremendously helped my restless leg. I can do that probably 15 to 30 minutes before bedtime, and it seems to eliminate the restless leg. And it's not a very harsh vibration, but it definitely makes your legs relax a lot. And so I found that that's very, very helpful.
Well, Kyle, thanks so much for sharing that approach. Dr. Spector, have you heard of this before?
So I've heard of vibration pads. In fact, they made one called Relaxis. I'm not sure if that's what Kyle has. He mentioned exercising on it. Relaxis, I thought was one you would lie on. That's off the market now, unfortunately. But I love non-pharmaceutical options for restless legs. What can we do to treat it without pills if we can? So this is great, Kyle, that you found something that sounds incredibly safe, highly effective. It's wonderful. There are other products on the market now. Relaxis is off the market, but now there are Nidra bands, which go around the leg and provide stimulation through the peroneal nerve in the leg. And that's a very safe option now that we have, now that Relaxis is off the market.
Tell us more about non-pharmaceutical options, please, because that is definitely something we are all interested in.
So the general class of non-pharmaceutical options for treatment often involve what we call counterstimulation, something that provides stimulus to the legs that distracts your mind from being sedentary. So whether it's a massage, heat, ice, anything that puts pressure, vibration, all of these different strategies can be very effective.
We'll talk about the medicines in a minute because there are now quite a few. But let's go to Fort Worth, Texas, Terry.
Bonnie, welcome to the People's Pharmacy.
Hi, how are you?
Good, Bonnie. Welcome to the People's Pharmacy. What do you have to share?
So I have had restless leg off and on for many years, and it definitely is not cramps. It definitely is not neuropathy. And it's kind of almost difficult to describe, but I would say it's like this building sensation that you cannot fight, but you absolutely have to move and stretch and push against this sensation, this overwhelming sensation. And if you try to fight it and not move and think, okay, I'm not going to move, I'm just going to sit still and wait for it to pass, the sensation just intensifies and builds until you start moving and stretching against it. So it's kind of torturous. You definitely can't sleep through it, or in the evening if you're just trying to relax and watch television or something, you have to just start stretching and kicking and, that sort of thing.
Well, thanks so much for describing it. What do you do for it?
For me, I find when I start getting waves of this coming on frequently, it's usually a signal that something else is out of balance, iron, vitamin deficiency, something like that. And it tends to, correlate when you get your yearly blood work and your doctor says, oh, this is off, you need to start focusing on this or changing your diet or whatever. But in the moment, preemptively doing these deep stretching before bed, like yoga poses and yoga stretches that really stretch and push those large muscles in your legs and glutes, that really, really helps in the moment, but also like preemptively to stretch like that before bed.
Thanks so much for sharing that, Bonnie. We really appreciate it.
Does all that sound familiar, Dr. Spector?
Yeah, that was a great story, Bonnie, and your description is about as classic as it can get. That is exactly what I hear from many, many patients. That overwhelming urge to move, and there's just nothing you can do when it sets in. You just have to move. And you're right. Something out of whack is what you said. Something's out of balance, and that is true because restless legs will get worse as a manifestation of anything else going on. It could be untreated sleep apnea. It could be a surgery. It could be an infection. We saw a bump in restless leg syndrome after COVID. And so anything causing a disturbance in the body will exacerbate restless legs. So I think you hit it right on the head, Bonnie.
And doing the yoga?
Oh, absolutely. Stretching along with exercise too. So that's another piece of that same puzzle. Using the legs will help.
We got an email from Susan who says it feels like the heebie-jeebies, which is probably a good description, except it doesn't tell us much more than restless leg syndrome does.
Right, and that's actually why I love the name restless leg syndrome, because it's one of the most descriptive diseases that we have, really.
Let's go to Frank in Fort Charlotte, Florida. Welcome to the People's Pharmacy, Frank.
Thank you very much. Terry and Joe, I listen to your radio show every Saturday morning, and I love it. I'm 66 years old, and I've had restless leg syndrome my whole life. I remember as a young boy, my father sometimes yelling at me, stop shaking your leg. You got to go to the bathroom, thinking that I had to, urinate. And recently I talked to my cousin, and I found out from my cousin that she has it, and her father had it. I'm wondering, I haven't heard anybody speaking about whether it's inherited from one generation to another. Is that possible?
Dr. Spector?
Yes, it absolutely can be inherited. We see it run through families a lot. If you were going to pick an ancestry that would be most at risk for this, it tends to be those families from North and West Europe. I see a lot from Ireland, England, Germany, Scandinavia. And so I'd be curious if Frank's family traces their origin to that part of the world, because there are genes that come frequently from that area. And a lot of those genes have to do with the way the brain gets iron from the blood. It's not easy for everybody to move iron molecules from the bloodstream into the brain, and mutations in those genes can run in families.
So tell us about the medicines, because you've already told us that exercise can be helpful, that vibration can be helpful, that maybe iron can make a real difference. Some people say magnesium works, some people say it doesn't, but tell us about the drugs that you prescribe.
Well, the first drug I start with is intravenous iron. So you can get iron over the counter, but if you really wanted to address this aggressively, we'll do an infusion of iron. And I like to start with that. I want my iron levels high.
Because not everyone absorbs iron well.
Exactly right. So if you're not absorbing it through the stomach well, or if you want a really high level, it's almost impossible to get there with pills alone. So we'll bypass the gut and go straight to the bloodstream and really get the iron level high. And that's a prescription. So that I consider among the drugs.
Okay.
Now, for many years, and I'd say over 20 years, the first line therapies for restless legs have been what we call dopamine agonists. These are drugs that stimulate dopamine receptors in the brain. There are three of them that we use commonly: ropinirole, pramipexole, and rotigotine. And those three drugs' brand names are Requip, Mirapex, and Nupro. So if
The
you've heard of
brand
the
names are a
singers.
little easier to say and
Mhm.
remember. These are, aside from Nupro, which I think might be specific for restless legs, the other two are also used for Parkinson's disease, aren't they?
Yes, they can all be used for Parkinson's disease, and all three of them have similar mechanisms of action. But after 20 years of being first line, there were new guidelines in the American Academy of Sleep Medicine that came out in September of 2024, telling us we really can't keep using these regularly anymore because they're too dangerous.
We'll get to that in a
Okay.
minute. We actually have an email from Paul. He says, I've had Parkinson's related restless legs. How can you tell the difference in restless legs? So, related dyskinesia. My legs move at night while resting, but not asleep. So, the connection to Parkinson's?
So there is an overlap in the sense that patients with Parkinson's disease are more likely to have restless leg syndrome, although those with restless leg syndrome are not necessarily more likely to go on to develop Parkinson's disease. It's not a
Okay.
risk factor. So it really only works one direction.
That's helpful to know.
And people with Parkinson's disease, after they've been on medications for many years, will develop what Paul referred to correctly as dyskinesias, and that's when the legs or the body will move uncontrollably. The difference with restless legs is the urge to move. It's the sensation you have to move, not the movements themselves. So the dyskinesias are uncontrolled movements, not necessarily accompanied by that urge to do it. It just does it on its own.
Now, you mentioned the medicines. There's a really weird side effect that we read about some years back. Gambling. Really?
Or other types of compulsive behaviors as well.
Tell us about that weird, odd, crazy side effect.
Yes. So this is one of the most dangerous side effects of the dopamine drugs. We call them impulse control disorders. And there are four classic common ones that can occur. It's compulsive eating, compulsive gambling, compulsive shopping, or compulsive pornography use. And those are the four we see manifested in our patients, particularly as doses of these drugs go up. And actually, it's the Parkinson's disease population that will see it most because they use higher doses than the restless legs population. But when people with restless legs get inappropriately put on extra high doses, you're going to start to see this complication more and more. And it can be devastating. I mean, hundreds of thousands of dollars can just vanish from the compulsive gambling and shopping.
Oh, that's scary. We do have a couple questions from listeners about medications. So let's start with Patricia in Durham, North Carolina. Patricia, you're on the People's Pharmacy. What's your question about a restless leg medication?
Are you speaking to me?
Yes, we are.
Oh, okay. I've been under a neurologist's care for like 8-9 years, and this is the medicine that he prescribed, and I had been on all
What
along.
medicine is it, Patricia?
Pardon me?
What medicine is it?
It's a. I'm gonna have to spell it out. I take two medicines. You have to take one with the other. It's Cova, Lova, 25 to 100.
Okay.
And I
Carbidopa,
have to take
levodopa.
one. Okay, and the one that I have to take with it is also the same, Carbilova, and it's 50 to 200.
Okay, let's find out a little bit about this medicine. Dr. Spector?
So the three drugs I just mentioned, the Nupro, the pramipexole, the Mirapex, and the Requip, those are all drugs that stimulate the dopamine receptor. Carbidopa levodopa is essentially taking dopamine itself. So it's dopamine replacement therapy. It's highly effective when you first take it for restless legs, And then people tend to develop a major complication from that drug, which leads to a worsening of symptoms over time. So people who take carbidopa levodopa will often experience their symptoms getting worse and worse and worse the longer they stay on that drug. So it's not a recommended drug at this point for the chronic management of restless legs.
Let's go to William in Amarillo, Texas, because he also has a question about medication for restless legs. William, what's your question?
Hello, thank you for taking my call. Yes, I've had restless leg for quite a few years, and I've been taking a prescription medicine. Starts with a P. I don't have access to the name of it right now, but it's Phenafol or something like that, and it seems to work as far as mediating a condition, because my condition is it could wake you up in the middle of the night. Your leg just would start jerking, and then it'll stop, and then actually just even like maybe a few seconds later, it'll jerk for just a second or two and cause your leg, you move your legs and try and alleviate the condition, but it doesn't seem to do anything. It just is a matter of waiting it out.
And
Time or not.
William, do you have a question for Dr. Spector?
Yeah, how many different types of prescription medications are out there that deal specifically with restless leg? And I want to throw in at the same time, I do have Parkinson's, but I had the restless leg considerably before the Parkinson's.
Okay, well, thank you.
Dr. Spector?
So there are a variety of different medications, but many of them are not actually FDA approved. We only have 4 FDA approved drugs for restless leg syndrome. And so when we talk about the different classes, we're really going a bit off label to do that. The ones we've talked about already, the dopamine drugs, I think maybe you're referring to a drug called pramipexole. That's the P drug I assume you're talking about, especially if you have both Parkinson's disease and RLS. And so it's a different story when you have Parkinson's disease also, because the pramipexole could be treating that also. There are other classes of drugs. The big class of drugs we haven't talked about yet are gabapentinoids. And those are gabapentin, pregabalin, and gabapentin and acarbil, which go by the names Neurontin, Lyrica, and Horizont.
We're going to switch gears, Dr. Spector, and start talking a little bit about leg cramps when we come back after the break. Who hasn't experienced leg cramps at some time in their lives, especially when it wakes you up in the middle of the night? We're also going to take a call from Rick in Tampa, Florida, who wants to know the relationship between statins and leg cramps. Rick, thank you for being patient all this time. If you'd like to join the conversation, if you've ever had leg cramps or you've used a remedy that has worked, we'd love to hear from you.
Our lines are open for your questions and your stories. 888-472-3366.
Our email is radio@peoplespharmacy.com, or give us a call, 888-472-3366. We're going to talk a little bit about leg cramps and something strange called akathisia.
You're listening to The People's Pharmacy with Joe and Terry Graydon.
Welcome back to the People's Pharmacy. I'm Joe Graydon.
And I'm Terry Graydon. The People's Pharmacy is made possible in part by CocoVia Dietary Supplements. CocoVia Cardio Health is offered in both convenient capsule and powder formats, with each serving containing 500 milligrams of cocoflavanols to support heart health. More information at cocovia.com.
Today we've been talking about restless leg syndrome. Now we'd like to open the lines to some other conditions such as muscle cramps, periodic limb movements, akathisia, neuropathy, sleep onset myoclonus. What the heck is that? Our lines are open for your calls at 888-472-3366. As the lines are full, you can email us radio@peoplespharmacy.com.
We're talking today with Dr. Andrew Spector. He is an associate professor in the Department of Neurology at the Duke University School of Medicine. Dr. Spector is the author of Navigating Life with Restless Legs Syndrome. And now we're talking about leg cramps, and we go to Rick in Tampa, Florida. Rick, welcome to the People's Pharmacy. Thank you for being patient. Go ahead with your question, please.
Thank you for taking my call. And my question has to do with a side effect that's relatively common with the use of certain statin drugs, which results in leg cramps, and they can be kind of severe. And so, for example, my wife had to get switched on her statin drug because it was just too painful to stay on. So I was curious if somebody there, either you, Joe, Terry, your guest, could address this issue, why that is, and again, what somebody could do about that.
Dr. Spector, we'll give you the first chance, and then we could probably wax eloquent about statins and leg cramps for a long time.
Right. Thank you so much for that question, Rick. We really appreciate it. Dr. Spector, I cannot tell you how many people complain about muscle pain and weakness associated with statins.
Cramping and cramping.
And
it's very
cramping.
common.
Do we have any idea why statins might do that?
We know that it does because we've all heard it, right? We've heard it many times. And, the reason it does that, I can't give you the answer. I'm going to let you take that because I think you've got one ready to go. But I know that there are a lot of good options out there, especially for management of cholesterol and lipid levels. And I think, what Rick said, we had to switch statins. I think that can be a solution sometimes. It's just one statin doesn't sit well with you, so you try another one, and sometimes that goes better.
Let's go to Sharon in Ithaca, New York, who has another leg cramp question. Sharon, welcome. Share your question, please.
Hi, this is Sharon from Ithaca, New York. Yes. Well, I guess my question is, and maybe you've answered it, I get terrible leg cramps at night, and I'm just wondering if there's, and I'm a family medicine doc, and I just wonder if we're doing any research on it. I try magnesium. Every night I take my cocktail of magnesium, tonic water. I start to add potassium, but I think I'm going to add CoQ10, given what you just said about statins and cramps, because I know that statins decrease CoQ10 in the body, and sometimes we take CoQ10 with statins. So I might add that to my cocktail, as well as exercise and stretching and hydration.
Well, here is Sharon, a physician, family practice doc, who needs your help, Dr. Spector. What causes leg cramps and what can be done about it? You used to prescribe, well, I won't say you personally, but many of your colleagues used to prescribe quinine.
That was probably before Dr. Spector's time.
In fact, when I was in med school, we were instructed not to give anyone quinine, and now it's actually making a comeback.
Is it really?
I think it is, yeah.
It's been banned by the FDA. The FDA is very clear. Doctors do not prescribe quinine.
And the reason is that for a small but significant proportion of people, quinine can be very dangerous.
Right. The cardiac effects would be scary,
and blood effects as well.
But it can work. There's no question it can work. And I wonder when Sharon mentioned that she's using tonic water, I suspect there may be some quinine in that.
There should be.
There absolutely is.
There usually, if in the good tonic water, there is quinine. So we suspect that's in Sharon's cocktail. One thing you might want to try, Sharon, is when the leg cramp strikes in the middle of the night, a spoonful of yellow mustard can take it away quickly. Have you tried that?
Well, I had a friend who told me to sniff something with a strong smell that might make it go away. And
I would try the yellow. I would try swallowing the yellow mustard. I find that works very well.
And Sharon, if I could give you a tip, and I'm going to tell you what my father told me. And if he's listening today, he'll appreciate that I did listen to him. That it's the old Amish stops leg cramps formula. You can buy it on Amazon. You could buy it in a lot of stores. It's easy to find. It's not expensive. And it's a mix of ginger, garlic, and apple cider vinegar.
Okay.
And you can rub it on the cramp. You could drink a capful before bed and prevent the cramp. And I'll tell you, my dad swears by it. So I'll pass that
And
tip
what's
on
it
to
called
you.
again? Old Amish?
Old Amish. Yeah.
Cool.
That
Well,
stops leg cramps.
this fits perfectly with our theory of leg cramps because football coaches have been recommending, for example, pickle juice
Pickle juice.
for decades. This is usually in July when they're just starting practice and it's hot and everybody's running around
It
and
works
sweating.
fast. Just like the yellow mustard. It works fast.
I wonder if the common theme here is the vinegar.
Vinegar could definitely be part of it. The thing that we think it's doing is activating TRP, transient receptor potential channels. Now, you say, what in the world is a trip? And that's what it is. It is an ion channel on a nerve, and they are transient and they act very quickly, but they control the nerves. They help control the nerves. A lot of these TRPs are used by the body to detect temperature. So the TRPA1, which is stimulated by capsaicin, the hot stuff in hot peppers, is also sensing heat, which is why we call hot peppers hot. And the TRPM8, which responds to menthol, is there sensing when things get cool and chilly, which is why menthol or mint has that cooling effect. Joe, you can finish up on telling us how it works against leg cramps.
We think it has something to do with the neuromuscular junction and the fact that when you stimulate these trip channels, it's activating the vagus nerve, for example, and it's overriding that nerve muscle cramping problem. So all we know is that an awful lot of people tell us it works. We won't even bother telling you about soap under the bottom sheet, but I will read a interesting message from Christopher. Christopher has an email. He says, here's my leg cramp solution. I've tried everything to eliminate leg cramps. None of them worked at all. I figure there are so many home remedies because there are so many causes. By accident, I found something that works for me. I saw my physical therapist because I had bad cramping and pain in my plantar fascia. She showed me how to massage the soles of my feet with a tennis ball. I've never had a leg cramp since. I presume there is some tissue-muscle connection. And so that was Christopher in Ithaca, New York.
Sounds good. And I think we're going to talk to Julia Ann and see what she has come up with. She's in St. Paul's, North Carolina. Julia Ann, welcome.
Wow. Yes, I have been dealing with restless legs since I was a teenager. I'm 72 and dealing with long COVID. I also have a brain injury from birth. Been through the entire testing with small cell testing, nerve conductivity testing for neuropathy, all of the MRIs, CAT scans, etc. I am allergic to every drug marketed, including capsaicin. My most favorite remedy now, because it went from restless legs to large muscle spasms that are so painful, I scream. The most painful thing I've ever endured is deep breathing, meditative, deep breathing. And every night when I can, I take hot Epsom salt baths. I will use the pickle juice vinegar, the magnesium glyphosate, but the deep breathing, I have to force myself to do it through the pain. But using John Kabat-Zinn's body scan.
Well, thanks so much for sharing that, Julia Ann. I think a lot of people could try that and see if it works. It's the first time we have heard that it's helpful against cramps. Joe, where do you want to go next?
I want to go to Stevensville, Texas, and talk to Barry.
All right. Barry, welcome to the People's Pharmacy.
Thank you. I've had restless leg and I've had bad problems of cramps in my legs. My main problem is neuropathy in my feet. I've tried gabapentin and I've taken, mass quantities, and all that did was make me fat. I'm currently taking Lyrica, and that has seemed to really help. It helped. I really no longer have restless leg or cramps, and my neuropathy, it's really helped it. I still have the little explosions, on my feet during the day, but I would highly recommend the Lyrica. That has really helped me.
Thank you very much for that, Barry. What is the difference between Lyrica and gabapentin, Dr. Spector?
Those drugs are in the same family. They're very similar drugs. Lyrica is often metabolized and utilized by the body a little more consistently. And so I have several patients over the years who switched from gabapentin to Lyrica and found that to be the solution, because gabapentin is a tricky drug and some people really don't utilize it well in their bodies. It doesn't work for them. Now, I will say Lyrica has the potential to make people gain weight as well. So you don't necessarily eliminate that possible side effect from switching to one or the other, but the Lyrica could be a lot more effective for people.
And that would be helpful. Let's go to Adam in McCall, Idaho. Adam, you've got an interesting question. Share it with us.
Hello. I had a question about your thoughts on using leeches. My granny, she had restless leg and leg cramps pretty bad, and she said that she felt a lot better because she used leeches. She said that they thinned her blood out, and it made her legs feel better. And I was just wondering if there was any validity to that at all.
Oh, well, Adam, thank you. We have never heard that. Dr. Spector, have you?
Nope, that is a new one. And this one side of me says if we're losing blood, we're losing iron, and that would make things worse. But Adam, if your grandmother said otherwise, who am I to say it didn't help her, right? I wouldn't generally recommend it, but I'm glad she found something to take away her suffering.
My grandfather, who I'm named after, Joe, was a pharmacist in New York City at the turn of the century, and I'm talking about the
turn of the 20th century.
He had a bottle of leeches on his counter because pharmacists actually sold leeches back in those days. It freaked my mother out, as you can only imagine. You can't just buy leeches anymore. They're not readily available in pharmacies.
Prescription only, Joe.
Yeah, prescription only. And plastic surgeons use leeches occasionally after surgery to reduce the blood accumulation in a digit, for example. But the idea of using leeches for leg cramps seems a little scary to me, because when we were in Australia, we ended up with leeches after walking in the woods. And it was, having these things sucking your blood is
it's kind of creepy.
Yeah, definitely creepy. We are almost out of time, Dr. Spector, and I promised akathisia. What the heck is that, and what drugs can induce it?
Akathisia is an internal restlessness, and it's very similar to restless leg syndrome because the sensation of restlessness you get when you have RLS is a form of akathisia, that need to move. But when we refer to it as akathisia, we're usually referring to it more in the whole body, the whole day, not just the legs at night, as restless legs typically is. So this is sort of that overwhelming urge that you really can't sit still. And if somebody with akathisia comes into your medical office, for example, they're pacing the room, right? They're not just sitting and talking comfortably. So a lot of drugs can do it. We see it with predominantly antidepressant, antipsychotic medications. Those are the ones that are most likely to do it. And you can get them both when you're taking them or even sometimes withdrawing from them.
And do they also make restless leg syndrome worse?
Yes. So because they are part of the same type of problem, drugs that would cause akathisia can also exacerbate restless legs.
And medications like diphenhydramine. Tell us about DPH. It's an antihistamine. It's the drug in Benadryl. And I think a lot of the nighttime pain relievers, we call them the PM pain relievers because Advil PM, Aleve PM,
Tylenol PM.
Tylenol PM have diphenhydramine. What's the problem with diphenhydramine?
Well, there are a variety of problems with diphenhydramine, but in the restless legs world, it is an antihistamine that gets into the brain. It's a sedating antihistamine, which is different from some of the non-drowsies. The non-drowsies won't do this, but sedating antihistamines and all the PM drugs, they'll exacerbate restless leg syndrome for the most part. And there's an irony to it because people are trying to take them to sleep, and then it just makes their legs worse.
Do you have, in a minute or a minute and a half, any words of wisdom for people to get a good night's sleep?
So the number one piece of advice I like to give is that we can't worry too much about our sleep or we won't sleep well. The more we think about it, the worse it gets. Sleep is a natural process. We can do it if left alone. And spending too much time thinking, analyzing, worrying about it just makes it worse.
We will have to have you back just to talk about sleep.
Because that is all the time we have today. Thank you for listening and sharing your stories, and thanks to our guest, Dr. Andrew Spector. He is author of Navigating Life with Restless Leg Syndrome. Dr. Spector is an associate professor in the Department of Neurology at Duke University School of Medicine. He has a clinical practice in sleep medicine and serves as the program director of the Sleep Medicine Fellowship. He's also consultant for the Duke Athletic Sleep Optimization and the vice chair for Professionalism, Inclusion, Diversity, and Empowerment.
The People's Pharmacy is a co-production of North Carolina Public Radio, WUNC, with The People's Pharmacy.
Lynn Siegel produced today's show. Pamela Alberta and Ayasi Chinflu provided technical assistance. Al Wadarski engineered. The People's Pharmacy theme music is by B.J. Liederman.
The People's Pharmacy is made possible in part by CocoVia Dietary Supplements. CocoVia Memory and Focus is a unique formula made with a special blend of ingredients that work together to promote attention and support long-term memory. More information at cocovia.com.
Today's show is number 1419. You can find it online at peoplespharmacy.com. You could subscribe to our podcast through your favorite podcast provider. We post the show on our website on Monday morning. That's where you can share your thoughts about this show, or you can also email us your comments, radio@peoplespharmacy.com.
If you go to peoplespharmacy.com, you can sign up for our free online newsletter. It's an easy way to stay on top of the breaking health news. By subscribing to our newsletter, you'll also have regular access to our weekly podcast and find out ahead of time which topics we'll be covering. You'll also find a bunch of home remedies for leg cramps and restless leg syndrome, including soap under the bottom sheet. In Durham, North Carolina, I'm Joe Graydon.
And I'm Terry Graydon. Thank you for listening. Please join us next week. Thank you for listening to the People's Pharmacy Podcast. It's an honor and a pleasure to bring you our award-winning program week in and week out. But producing and distributing this show as a free podcast takes time and costs money.
If you like what we do and you'd like to help us continue to produce high-quality, independent healthcare journalism, please consider chipping in.
All you have to do is go to peoplespharmacy.com/donate.
Whether it's just one time or a monthly donation, you can be part of the team that makes this show possible. Thank you for your continued loyalty and support. We couldn't make our show without you.